A national study shows an increase in the use of diluted baby formula among families, which comes as the formula shortage still persists in parts of the United States. Natalie Kutchko joins us in the newsroom with more on this dangerous trend. Natalie.
Well, Teresa, the study comes from BMC Pediatrics and shows a 40% increase in the number of people who have used at least one unsafe feeding practice since that shortage began. While that has largely subsided in our region, experts are still calling for solutions. Those include more manufacturing, better access, and further support in health coverage.
And so I'm living this again, and it's pretty scary for families. This hasn't fully gone away, and the fear hasn't gone away.
Andrea Ippolito is a mother to a newborn and the founder of Simply Fed, a national lactation consulting company created just before the pandemic. The stressors U.S. families face, prompted by the baby formula shortage, she says still exist.
We need more solution. We need more manufacturing of formula in the U.S. outside of the incumbents that are the ones that put us in this situation in the first place. And we need more support and services for breastfeeding and baby feeding by trained professionals such as lactation consultants, who, by the way, are the experts.
A recent study published by BMC Pediatrics not only shows an increase in unsafe feeding practices since the formula shortage started, but includes an up to 30% reported rise for use of watered-down infant formula.
This is particularly troublesome because formula has been authorized by the FDA to have exactly what your baby needs to grow and thrive and just be successful on their feeding journey.
Dr. Bridget Young with URMC says despite the shortage weakening here, she says some are still needing to make adjustments. She also says diluted formula remains an ongoing conversation with local parents.
Also really relevant for families who just have limited financial resources and maybe wanting to stretch their formula because formula can be really expensive. And if that's the situation, really educating parents that we do have a lot of resources.
And for more information on those resources available to us locally or to view the full study, you can find those details in this story on our website, rochesterfirst.com. In the newsroom, Natalie Kutchko, News 8.